Hi, Namaste. I am Dr. Krishnamohan, Clinical Director and Head of the Department of Surgical Gastroenterology and Bariatric Surgery. I am a robotic, laparoscopic and GI surgeon. Here I am going to discuss with you about hernia. What is hernia? It is weakness in your abdominal wall. In the core set of the abdomen, there is some weakness at some point. Like some people will have at inguinal region, groin region. Some people will have in the abdomen at various places. It is called as umbilical hernia, inguinal hernia, epigastric hernia, spigelian hernia, like this. Depending on the position of the hernia, the name is given. But every hernia cure is one and only surgery. There is no medical treatment possible for hernias. But this hernia can be done in two ways. One is hernia repair, where commonly you talk to many surgeons and many hospitals, they offer you this, where they just wanted to put some stitches and close the defect. But I am talking to you about hernia construction, where we are trying to deal with the root cause of the disease. It is the weakness in the abdominal wall. Our abdominal wall has different layers. It is peritoneum and two fascias and then muscles and then peritoneum. So you have different layers in the abdominal wall. So which type of weakness you have in the abdominal wall, that you need to understand. Otherwise, a regular hernia repair may fail. You may get it back. If you need a better solution, think of hernia construction, otherwise called as AWR, abdominal wall reconstruction procedure. This can be done again laparoscopically or by robotic surgery, and you can recover in 24 hours. And 99% this is permanent surgery. So contact us and we help you. Thank you.